This Health in Focus is a paid segment by Jagannathan Neurosurgery.
Welcome to another Health in Focus with Dr. J. Jagannathan, board-certified neurosurgeon. And also joining us, Janice. Today we're talking about lumbar stenosis. So first of all, Dr. J, tell us what this is all about.
So lumbar stenosis is usually a term referring to compression of the nerves in the back or the lower lumbar region that's caused by things like arthritis, disc bulges, or degeneration in the back. And typically when that happens, because the nerves are compressed, the symptoms can not only be back pain, but pain radiating down the legs, especially when walking or being active. And oftentimes pain improves when a patient rests or when they lean forward, which creates more room for the spine.
Okay, and this is fairly common as well.
Yeah, it's very common. Low back pain in general is probably one of the top 3 reasons why people visit their primary care physicians. So it's one of the top, definitely one of the top diagnoses we see in a neurosurgical practice. And as I mentioned, the symptoms can be fairly widespread, ranging from back pain to leg cramping, shooting pains, numbness and tingling, and weakness. So it can really kind of cover a fairly large umbrella of symptoms.
Okay, and then what ways can patients seek relief from this?
We always recommend the non-surgical treatments first. Those are going to be things like rest and anti-inflammatories. Physical therapy sometimes plays an important role in terms of helping. Sometimes it can be treated non-surgically. Steroid injections are often used as well. Just of note, the diagnosis is usually made with an MRI, so that's something that usually a primary care physician or subspecialist would order to see if those are present. And if these conservative measures fail, then usually surgery would be the next step in terms of looking to treat the problem.
Sure. All right. So Janice, tell us a little bit about your story and how this presented itself to you.
We've been working on this for over a year now. I went to the Levels Bridge Walk last year, and after we finished the bridge walk, I could hardly walk. So then I went from there to my doctor, got a couple of shots, and it worked for a little while, and then it went bad again. The pain started shooting down my right leg, and 3 of my toes went numb. At this point, they finally said, let's do some physical therapy. So I went to physical therapy 4 times for this. By the time I was blessed to find Dr. J, it had affected both legs. And when I went into his office, it only took us probably a week to get together for my first appointment. He came in, talked to me, took me back, showed me everything that was going on with my body, sent me back in the room, and I believe it was his physician's assistant came in and said, okay, how about the 20th? And I said, for what? And she said, for surgery. And I was like, that's not even 2 weeks away. Oh my goodness. Yes, please. And I cried.
But obviously you're feeling pretty good.
Pretty good. Pretty amazing. The pain is a lot different than what it was. And this pain now, it's a pain of healing. You get surgery. Now it's starting to kind of itch, kind of want to scratch at it. Move around a little bit and say, well, you know what, I could probably reach for that. But no, he told me not to do that, so I better not do that.
Absolutely. Well, I am so glad, Janice, that things are going so well for you. I'm glad that your pain has been alleviated. And of course, if people want more information, if they're having similar problems, they can always get a hold of Dr. J. You can head to our website, 9in10news.com.
This Health in Focus is a paid segment by Jagannathan Neurosurgery.